Hello, I'm Rick Merrill, President and CEO of Cook Children's Healthcare System. We have made a promise to improve the health of every child in our region. The Community-Wide Children's Health Assessment and Planning Survey, or CHAPS for short, is one of the many ways we are working to fulfill that promise. After taking a detailed look at the CHAPS data, Cook Children's chose 7 health issues to focus on over the next 10 years. They include abuse, access to care, asthma, dental health, mental health, obesity, and safety. While the data is an important part of understanding children's health, the CHAPS team knew that talking to people face-to-face would give us a clearer picture of the work ahead of us. Talking to parents was a first step, but if you want to know more about children's health, you should talk to children. Child life specialists from Cook Children's talk to the kids and ask them questions designed especially for their age group. In this video, you'll hear what kids think and how we will collaborate with communities to improve their health.
Well, the CHAPS identified that in our region, there are 111,000 children that suffer from asthma. And so their childhood and their normal activities are greatly impaired.
I've been to the hospital before because I had asthma.
Like when I'm wheezy, like this.
I felt really surprised because I knew what asthma was from my friends, but I didn't know it could do this much to you.
It also affects the parents. They miss work. It increases insurance premiums and doctor's visits.
And everybody's in agreement. Yes, asthma is a problem that we really didn't recognize as being important, but when we began to compare it with how other counties, what their students and children were suffering in asthma, we're at the high end, and it's something that we really need to take a look at.
Dr. DeCastro has really helped me a lot. She's helped me keep me together from being sick. She's been real nice. Everything that a doctor does, really.
And they're just gonna help you not to get sick.
Well, you may know Denton County is one of the largest counties in the state that does not have a county hospital. And so access to care for low-income families, and especially for low-income children, is minimal.
I like to eat nachos. Green beans.
Sometimes my mom will get grapes, and I love grapes and oranges.
And I like zucchini and squash. I do not like to eat squash. I don't like spinach.
Make sure that I don't eat too much sweets because that could probably rot in my brain maybe.
I think, like many of the counties, obesity stood out. 30% of our children or greater are overweight or obese, and that statistic alone is overwhelming.
We face the issue of economic problems because they're going to be going to the doctors more often. There's also the issue again of self-esteem. These children are left behind.
Some people have to have surgery to get skinny, and it's really bad. You just might get too fat, then blah, die.
This generation that's growing up today is the first generation of kids who aren't expected to outlive their parents. There have also been many studies that show that healthy eating affects your school performance. Children who eat unhealthily are 1.5 more times likely to have academic problems at school, and they're 2 times more likely to have behavioral problems.
In my area, Cleburne, we've done a lot in hopes of identifying ways to combat obesity.
Put on some tennis shoes, get a ball, play tag, hide and seek.
But my best of all exercising is riding my bike.
Physical education, keeping our children moving is very important and needs to be a priority everywhere, in school, in the community, and at home.
If you eat candy and don't eat vegetables, and you eat donuts and don't eat that stuff, and then you don't brush your teeth every day, you get a cavity.
The dental decay problem that exists in young children in Tarrant County and neighboring counties is just enormous.
Dental health has a great impact in the overall health of a child in terms of nutrition, in terms of self-esteem.
So to keep your teeth healthy, it's also part of your body, and you should keep it healthy too.
When people laugh at me, I usually sometimes cry.
And which doesn't make me smile is people that are like rude to me, mean to me.
I was happy a few years ago when I got my sister.
One of the other areas of the survey that was interesting to us was the mental health concept.
Children with mental health disease are at greater risk, 9 times more, to have problems in school. They also are likely to have poorer health.
With mental illnesses like other illnesses, the sooner you can get the treatment, the diagnosis, the sooner you can get treatment, the earlier you can get it, the greater the chances of success.
My sister and my stepdad and my mom and me ride with a seatbelt.
CHAPS data is invaluable to let us know where we need to focus our efforts. Departments around the Metroplex can take that information and look at the fact that parents think that their child safety seats are installed correctly when in fact they are not.
You have to wear a car seat until you're 8 years old.
You know, we need to emphasize to parents, make sure you get your young children in car seats. We need to make sure that all children are buckled up when they're in the car.
And the goal of all of us in the child safety seat world is to bring those numbers down, reduce the injury and reduce the fatalities.
I'm hoping that Wise County will be an even better place to grow up in, to raise your children in, to grow old in, especially now with Cook Children's bringing their resources to bear up in our neighboring county as well.
I think as time goes by, we'll be able to put our ideas together as we begin to look at other counties where this has also been done to see where their successes are.
We're prepared to donate time, to donate services, to help and assist young children who need help.
Now that CHAPS has been introduced into our community, I'm hoping that we'll have enough people come together and come up with the programs that are needed to take care of these children in our communities.
Public health is all about prevention. And so we believe that every investment that we make in children's health is a good investment and ultimately saves us dollars down the road.
We are in very early stages of meeting with all the community leaders and figuring out what is the best way to help the children in our region. So hopefully in the next 10 years we will have the healthiest children in Texas.